This is Jenny. I'm Virginia Hefkin. I'm going to be your nurse practitioner today. Nice to meet you. I see you've already changed. We've already had you empty your water. If you'll go ahead and just step on the scale for me.
Okay.
Okay, right at 200 pounds. Go ahead and step off for me. Sorry, honey. Right at 5'4". And you can go ahead and take a seat for me. I'm going to get your temperature and your oxygenation while we're sitting here.
Okay.
Under your tongue for me. Probe on and protect you. Alright, 98.3. And we're going to go ahead and get your oxygen while you're sitting here as well. Okay? Alright, you're at 98%. Alright, if you'll follow me, we'll go ahead and go on into our examination room to do the rest of the exam. You want to go ahead and sit on the table there facing me. Alright, Darla, the first thing that we're going to do is to go ahead and take your your vital signs, okay?
Okay, look.
We'll start with your blood pressure here. It may be a little high. Sometimes that happens when you go to the doctor's. It's called white coat syndrome. But it lowers after you have sat for a while, so. (138/82). And we'll go ahead and get your pulses here. Nice steady pulse at 2+, which is normal. That's what it's supposed to be. Pulse is 75. Respirations are about 16, even and unlabored. Now we're going to move on to just looking at your face. Just by looking at you, I can tell that everything's symmetrical. The outer occiput of the protuberance, or the protuberance occiput is even with the inner canthus of your eye, which is normal for your ears. Your eyes are nice and symmetric on your face, even, not excessive spacing in between. Your nose is equal and symmetric. Your lips are equal and symmetric. I notice no abnormalities at this point. Your eyelashes and eyebrows are nice and full. I'm going to move on to some palpation, okay, which is just light feeling. I don't feel any nodes or masses on your head. Your hair is nice and evenly distributed, not too coarse and not too thin. No masses on the face. Any sensitivity here?
No.
Okay. No abnormality there. Feeling the temporal pulses here. 2+ even. And I'm now going to move on to your eyes. Here. Alright, while I'm still on your face, I'm going to have you go ahead and clench your teeth. Alright, I'm feeling your temporal membrane. Open your mouth for me. Perfect. Frown. Smile. Alright, and puff out your cheeks. Alright, filling the temporal membrane, I noticed that there were no abnormalities. You were able to move it fine. Nice and consecutive movement with no clicking. I do notice that cranial nerve 5 and 7 are intact, and that's by your face doing the puffing of the cheeks and all of that. So now I'm going to ask you to close your eyes. I'm going to show you sharp and soft, or dull. And I want you to tell me on the area you feel it. This will be the soft, this will be the sharp. So go ahead and tell me the area you feel me poking and what it is.
Left chin, soft. Right, or sorry, that was right chin. Left chin, dull.
Okay.
Left forehead, sharp. Right cheek, sharp. Right forehead, soft, dull. Left cheek, dull. Right chin, sharp. Right forehead, sharp. Left forehead dull. Right cheek dull. Left cheek sharp. Left chin sharp.
Wonderful. You can open your eyes. Now that the testing's over, we're going to go ahead and look at your eyes now. I'm looking at them. I said they're nice and even. We talked about your eyebrows and eyelashes already. Palpating this, your lacrimal apparatus are no masses palpable, no abnormal tearing. I do not notice any edema or anything on palpation, and they're not sensitive upon palpation, correct?
Correct.
All right. Just looking at your eyes, I can tell that your sclera are with no injections, and they're nice and not jaundiced. Your conjunctiva, your irises are round and equal. Your pupils at about 2 or about 3 and then dilation, which is normal. What I'm going to ask you to do now is to go ahead and cover one eye, and I'm going to ask you to read a couple of names, just the last name. Go ahead and read that name for me.
Norman King.
All right. Cover the other eye. And read this name for me.
Chow Kovac.
Wonderful. Go ahead and uncover both eyes. All right. And go ahead and read this name, John Gray. Wonderful. All right. So that tells me that your near vision and cranial nerve 2 are intact. Also, what that told me is your accommodation was perfect in between your eyes as you covered and uncovered your eyelids or your eyes. Your pupils dilated to what they should, or constricted to what they should be. So you uncovered. I'm going to go ahead and look at them with a pin light here. Constriction is good, down to about a 2. As well as both right and left eye, bilaterally. All right, we're going to go ahead and move on to the eye examination here. All right, I'm looking for the red reflex here. This is my eye. And that eye as well, bilaterally red reflex is present. All right, now we're going to move on to your ears. Just looking at them, as I said, they're normal, equal, where they should be out on your head. I do notice you have bilateral piercings, but no other abnormalities present or visible. Upon palpation, I do notice that you have some scar tissue built up in your lobe there just from the piercing. That's normal. No other abnormal masses, anything like that. Now what we're going to do is I'm going to have you occlude one ear, and we're going to do what's called the whisper test. I'm going to whisper 5 or 6 numbers or letters, and you're going to go ahead and say what I whisper. Occlude one ear. Go ahead and occlude this right ear. A, 2, 3, 4, C, D, 6. And include the same. No cerumen or wax. Canal is clear. Tympanic membrane is nice and pearly gray. Handle malleus umbo and light reflex are present. No abnormalities noted. Alright, then we'll move on to your nose here. As I said, no abnormalities upon inspection. I'm going to do is just slightly palpate over your nose specifically. No sensitivity and, okay, no mass is felt as well. What I'm going to have you do now is I'm just going to look at it with the nasal speculum real quick.
Do I still need this or not?
No, you're good. Thank you. Sorry about that.
That's right.
All right. Just looking at your nose, I can see that the mucosa is pink, the turbinates are nice and gray, non-boggy. It doesn't look like there's any deviation in this nair. The left nair and the mucosa is clear. All right, same thing. Mucosa is pink with clear drainage. Turbinates are nice and pearly gray, and no septal deviation noticed and no bogginess. Alright, now what I'm going to do is just look at your mouth first. We already looked at it. I'm going to go ahead and grab some gloves and we're going to look inside of it, okay? Okay, go ahead and open your mouth in a nice relaxed fashion here. You know the dentation is nice and strong here, pearly white teeth. No correction obvious here. Go ahead and stick out your tongue for me. Move it from side to side. Alright, that tells me cranial nerve 12 to 14, first of all. I'm going to go ahead and grab some light and we're just going to look inside of it a little deeper. Go ahead. Alright, I'm just going to feel around in here. Go ahead and stick your tongue out for me. And say ah. Ah. Perfect. Uvula rises midline. Go ahead and stick your tongue again. Tell me when you start to feel a gag reflex. I don't want you to throw up, so just tell me when it starts. A little bit there? There. Okay. All right, gag reflex is present as well. Go ahead and open your mouth one more time for me. All right, hard and soft palate intact. Revasing on the soft palate. All right. So what that told me is the uvula rising midline with awe, and the gag reflex told me that cranial nerves 9 and 10 are working. 12 was the tongue, as I told you. Your Stenson and Wharton ducts were intact as well, which is wonderful and normal. So everything's working as far as that goes, okay? We're going to go ahead and move down to your neck now. The first thing I'm going to do again is inspection. I see some freckling, sporadic freckling, but all less than 1 millimeter. I'm going to go ahead and palpate. When I'm palpating here, or I'm palpating your lymph nodes. I'm going to go ahead and start with the preauricular. We're going to do your postauricular. We're going to do your occipital. We're going to do your cervical, post-cervical, deep cervical, and interior cervical. I'm also going to do your suprapulous anterior left here. And none of those are palpable and they shouldn't be. That's normal. Go ahead and do your trachea here, midline, and your thyroid is non-palpable, which is normal. Alright, now what we're going to move on to is I'm going to have you shrug your shoulders. Alright, that tells me cranial nerve 11 is working. Go ahead and bend your head from shoulder to shoulder, front and back. Perfect, and I need you to turn shoulder to shoulder. Alright, now we're going to do all those movements again against my hand. So first turn your head. Alright, other side. Forward. Back. Now side to side. Perfect. Wonderful. Working and symmetrical as it should be. I'm going to go ahead and move on. While I'm palpating, I'm going to go ahead and palpate your carotid pulses, which are 2+ on both sides. And now I'm going to listen. What I'm listening for are any bruits, okay? And those are just sounds that I can hear sometimes in arteries that tell me that a little too much blood is rushing through. Wonderful, no bruits heard, so that's a wonderful sign. Go ahead and put your hands out just like this. Move your fingers for me. Your wrists all around. Your arms up and down. Arms up and down. Perfect. Just going to palpate here. Capillary refill, and all fingers are less than 3 seconds. I'm feeling your epitrochlear nodes, and they are non-palpable. Also feeling your brachial pulses here. And those are +2. I'm going to go ahead and feel under your arms if you could just lift them up for me. Non-palpable nodes there as well. All right, what we're going to do now is we're going to move on over to your back. So what I'm going to do is I'm going to stop the video here so we can go ahead and move on to the next part, okay?